This is Surgeons' Hall in Edinburgh, Scotland. It was located at one of the oldest and most prestigious medical schools in the world. In 1870, there are 7 women who have fought under intense duress and scrutiny to be able to attend and earn their medical degrees. On November 18th, as they are walking to the hall to take an exam, they are about to encounter a mob that is on a mission to destroy their dream to succeed. Hello, everyone. This is Dr. Gail GoodReads, and I am Dr. Gail Dawson. And the book that we're going to talk about today is called Women in White Coats by Olivia Campbell. I've always been grateful for the opportunity to be educated as a doctor because I knew that women weren't always allowed to enter medical school. I had this idea, though, that their mission was more of a formality, and they just had to use logical argument to be allowed in with the men. Little did I know of the hardships that they had to endure, actually through their entire lives, to be able to fulfill the dream of becoming a doctor, until I read this book. This is the story of the first woman pioneers who broke through this enormous barrier and paved the path for future women, like me, to earn a medical degree and get a license to practice medicine that is considered equal to men. Much of the information is based on their journals, letters, and published opinions in the medical literature of the time. These women lived in the 1800s. But first, let's back up a little and talk about how the practice of medicine evolved. In many primitive cultures, women attended other women in childbirth, so they owned the obstetrical part of medicine by becoming midwives. The midwives were also adept at treatment of the sick by using minerals and herbs. These women met the day-to-day medical needs of their society and were extremely important in the health of the community. The late 1700s into the 1800s were known for the advancement of medical knowledge. Many treatments were still unproven. Procedures like bloodletting were popular, and arsenic and mercury were actually used as cures. But exciting things were starting to happen that had good results. Vaccines were being developed to prevent disease. Anesthesia was invented for surgical procedures, and the germ theory as a cause of disease was becoming accepted. Looking at medicine from a new perspective, medical schools were opening up, especially in Europe and the United States. The first medical school in the U.S. opened in Philadelphia in 1765, over 250 years ago, by 2 graduates of a prominent medical school in Edinburgh, Scotland. Women were not allowed to enter any of these schools because it was felt that their delicate constitution and smaller brains would be detrimental to the profession. At that time, gynecologic knowledge was limited and full of misinformation with regard to the uterus and menstrual cycles. Also, the majority of women felt uncomfortable expressing their physical ailments to male doctors, especially relating to the reproductive system, and the doctors were ill-equipped to handle them. The men graduating from these schools, though, were intent on expanding their practices. They told the public that as doctors, their education in childbirth made them superior to the midwives who had been doing it for years without proper training. The reality was, though, that many of these students had never attended any births at all during training and had no practical experience in this area. It was this situation that prompted 26-year-old Elizabeth Blackwell to consider getting a proper medical education. She was visiting a neighbor who was dying of an advanced uterine tumor, and the neighbor lamented that her male doctor lacked compassion and the knowledge to improve her condition or even alleviate her pain. Elizabeth started thinking about women and their lack of accessible, humane medical care, and she wanted to make a difference. At that time, women of means like Elizabeth could be teachers or governesses, but had no access to medical degree. She decided to take on the weight of becoming the first female physician in 1847. This book is about her journey to become the first woman MD in the United States and 2 other women who took a similar path in England, Elizabeth Garrett Anderson and Sophia Jex Blake. The book talks about the barriers they encountered. They were denied equal access to lectures. They were charged more than the men. They even got expelled during the middle of their training program, not for incompetence, but exactly the opposite. The men felt threatened by their exemplary performance. They were ridiculed by published letters in newspapers and medical journals. They were spit upon during lectures and were the targets of derisive remarks. There's one incident that gained momentum and escalated into a riot. In 1870, 7 women students were on their way to Surgeons' Hall in Edinburgh to take an anatomy exam when a group of male students began jeering at them, throwing mud and rotten vegetables, and would not let them enter the gates. They were finally let in and had to take the exam while the yelling continued outside. This infamous incident is called the Surgeons' Hall riot, and it reminded me of the incident in Greensboro, North Carolina in 1960, when 4 black men sat at a lunch counter that served only whites and were traumatized by a riot of white folks. These men refused to give up their seats, just like the 7 Edinburgh students who refused to be intimidated. It's important to note that this era was during the time of huge social change for human rights. The suffragette movement was gaining momentum, and the institution of slavery was being taken apart. The idea of women as physicians seemed ludicrous to many people, but the time was ripe for it to happen. They persevered, and with the help of some like-minded women and supportive men, they ultimately prevailed. The book also focuses on the accomplishments of these incredible women. Many spent their lives helping underserved people get proper medical care. They started hospitals, clinics, and even their own prestigious medical schools. True equality for women in medicine is a target that we're still trying to hit. I can personally attest that 150 years later, discrimination still exists for women physicians. I have had a male colleague shut the clinic door in my face as I was entering. I have been told by a male Muslim that women don't belong in the cath lab, even though I had a stellar record in this area. I was underpaid relative to my male counterparts by my white male bosses. At a later job, I was fired unjustly by Muslim employers. I've endured harassment from a woman hospital administrator. The most egregious dismissal, though, was that during my training program in cardiology, the men held a performance awards ceremony that intentionally excluded the women in my program, nor were any of us considered for awards. There were faculty in attendance, dinner, and pictures of the men receiving their awards that later hung on the walls of the hospital. We did not find out that this took place until after the ceremony. That one still stings. After all this time, there remains significant resentment of our abilities to excel. But like my lady pioneers, I know I make a good contribution, and I know that women in white coats are here for a singular purpose. We want our patients to do better. I never realized that the admittance of women into schools, such as medical schools, was such a seismic revolution in Western society until I read this book. The most impressive thing I learned was that these women helped raise the bar of our expectations of medical professionals. They published reliable case reports in the medical journals based on their extensive experience and observations. They established the groundwork for the scientific process that we use today to recommend medicines and procedures that are proven to work. These methods have essentially doubled the lifespan of our species and significantly improved quality of life. These women of ambition, virtue, and empowerment, also known as W.A.V.Es, changed the face of medicine to make it a compassionate, effective institution where the poor could also get treatment. We are extremely grateful for the efforts of these humble, hardworking, and determined women who were able to bestow such a huge gift to future generations. I hope you get a chance to read and enjoy this book. I certainly did. This book is Women in White Coats by Olivia Campbell. Thank you for watching, and we will see you next time.